work as a caregiver is physically and emotionally demanding because you have to give so much of yourself to the patients that you care for. Hi, I'm Kathy Getrist, and today's topic of discussion is about caregiver stress. A recent study was done which asked caregivers what motivated them to become caregivers in a healthcare setting. Probably no surprise to many of you, the number one reason was the satisfaction that was experienced from caring for others. Even though that is a very important reason why we go into caregiving responsibilities, it doesn't mean that it's without stress. Stress is mental and physical tension and strain. The stresses that most caregivers report are the coping with residents' death. Think about if you were working in a long-term care facility and you'd cared for the same individual for a year, maybe 2 years, gotten to know their family, maybe their spouse, and they die. It's as though a member of your own family has died in that situation, and it's very sad and is very stressful for caregivers. Another is communication problems. Communication problems are not only with those that you work on the unit with, but it's folks in other departments. It's communication with family and patients as well. Conflict with family members can also be a source of stress. Sometimes family members seem to be very difficult to work with and are asking what seem to be unreasonable requests of you. Another source of stress is dealing with demanding patients. When we are in pain, sick, or are uncertain about what our future might bring, it does not bring out the best in us usually. It's a time when we are focused on ourselves, can be irritable, and that is a source of stress for caregivers. Working with others is stressful. You know what it's like to live with others, and the stresses that is in each of our homes. So too is working with others a source of stress. Balancing work and home is also stressful. Each of those places wants more than half of us, and it's a balancing act to try to meet both expectations. Sometimes there might be a sick child and it's difficult to come to work. Sometimes you're asked to work overtime or an extra day, and you have demands at home. So balancing that is a very stressful experience. Before you can learn some techniques to cope with the stresses that you and that we all experience, it's helpful for you to recognize stress when you're experiencing it. First of all, know that stress is normal. Stress is something that all of us experience multiple times in the course of any given day. There are two types of stress. One is a positive stress called eustress. Eustress can be motivating. Take the example if you had an exam coming up tomorrow. It's very motivating. The stress that you experience today can be very motivating to be sure that you study and can do well on that exam. Also can be exhilarating. Positive stress such as preparing for a wedding or the birth of a child, even though very stressful, is an exhilarating experience. Also, positive stress can take the form in an emergency situation. Think about if a child darted out in front of you and you're driving a car. The ability to be able to slam on your brakes, to be able to stop in time to keep from hurting that child is a positive stress. That's called what we all have within us, the fight or flight mechanism. When that happens, an emergency situation happens, our eyes dilate, we become more focused on the event, our heart rate accelerates, our muscles tense, and other physiological changes occur and allow us to be able to act fast in an emergency situation. Distress is negative stress. It's chronic stress that has it takes physical and psychological toll on individuals. Chronic stress can be due to procrastination, can be due to relationship problems with others, and all sorts of other things, and need to be resolved as it will cause many physical and psychological health issues in the future. There's some general signs of stress. First, difficulty relaxing or slowing down. That means the individual might be fidgety, they might be tapping their pencil, tapping their foot, gritting their teeth, certainly a sign of stress. Overreacting to small events or problems, being short-tempered, seeming to make a big deal out of what you might term to be not that big a deal at all. Having trouble sleeping or waking up in the middle of the night and not being able to get back to sleep, another sign of stress. Increased use of alcohol or other recreational drugs in an effort to relax. Weight loss or gain. Some people under chronic stress will eat everything in sight. Others won't eat anything at all or have a very difficult time eating. I'm one of those latter people. When I'm under a great deal of stress, the last thing I want to do is to eat something. Feeling very weak, exhausted, tired, maybe not taking care of your personal hygiene, other signs of stress. Having a short attention span or not seeming to pay attention to what's going on at hand. A feeling of being preoccupied with the stress that is being experienced. Having trouble getting out of bed in the morning and carrying on with the day's activities, whether they be going to work or doing what needs to be done at home. Multiple complaints of physical aches and pains, another source of stress. And you could add to that list many others, I'm sure. Chronic stress takes its toll on us physically and emotionally. Hypertension, which as you remember is high blood pressure, is one of the problems of chronic stress. Stomach problems such as ulcers, gastritis, acid stomach, depression and anger. Decreased immune system, which prevents us from being able to ward off infections, is another cause of chronic stress that has its effects on health. And chronic headaches and backaches has been researched as a real problem with chronic stress. All of us try desperately to find ways to cope with stress. There are some healthy coping strategies and there are some faulty coping strategies. The first I'd like to focus on are the faulty coping strategies and should not be used. The first might be drinking lots of coffee or other caffeinated beverage, as opposed to drinking maybe just 1 cup. The use of a lot of soda. Soda is not a very healthy choice as far as a beverage is concerned. Lots of junk food. It could be chips, could be cookies, could be any other thing that might be in a fast food restaurant, for example. Candy, popping candy, chocolates, whatever kind, ice creams, in an effort to try to soothe our stress. What about the things that you read? The media is full of stressful things. It might be gossipy kinds of things. It might be violence that you might see on television. Filling yourself with chronic media that is destructive to your emotional health is going to increase rather than decrease stress. How about Tums or other kinds of antacids to try to get rid of an acid stomach, using them continuously? Something like ibuprofen or aspirin for chronic headaches that are caused by stress. Both of these medications are used in a very positive way on occasion, but should not be used on a consistent basis, as any medication used repeatedly will take a toll on your health. Another faulty coping mechanism is the use of alcohol and tobacco. If those are used in the short run, might seem to resolve your stress, but in the long run will take a toll on your health. I have some suggestions for some healthy coping strategies. One might be listening to some good music. Got a CD that of favorite songs can do a lot to reduce your stress. Reading something inspiring. I happen to be reading this book right now. It's called A Cup of Comfort, and it's a pick-me-up. It's short little stories that are inspirational and always feel good when I come away from having read one of those. Another book, it would be some meditation, prayer, or some source of inspiration, such as this devotional that I'm in the midst of reading right now. Helps make me feel more at peace. Sometimes getting a video or going to a movie that's funny can be very, very good for our stress levels. One of the things is that humor has been documented repeatedly, and laughter to be a real stress reducer. Pet therapy. I don't know that I'd choose a mouse for a pet, but a dog, a cat, any other kind of pet have really positive ways to help us with stress. They're funny, and they're able to love us unconditionally, and if that works in your home setting, can help reduce stress. Another thing might be use of one of these squeeze balls, muscle reducers, or using pillows against a wall, or something that's harmless in order to reduce muscle tension. How about excuse me, riding a bike, or playing racquetball, tennis, swimming? Any of those physical activities can reduce stress and also provide a lot of good exercise. Vitamins, going along with lots of fruit and vegetables. Fruit and vegetables, if you remember from the food guide pyramid, we're to be having up to 5 to 6 servings a day for a healthy, nutritious diet. This happens to be an example of aromatherapy. Aromatherapy is the use of fragrant oils and bath beads to be added to the skin or to bath water, and it helps reduce stress and provide a calming feeling to our bodies. Sometimes that's used along with a candle. If you've got the ability to be able to put a candle next to the bathtub, one of the ways that I use candles is each evening at our dinner table, I'm sure to light a candle and have fresh flowers on the table, and it seems to go a long way to calming down the events of the day. One of the last things I'd like to mention is that you will have, as I do in my work situation, an employee assistance program. It's a resource that you can turn to if you are extremely stressed in your work or in your family life. Don't hesitate to talk to the supervisor in charge about how to access that or some other resources for getting control of some of the stresses in your life. One of the things that I've been able to do is talk 3 nursing assistants into joining me in a panel discussion about sources of stress in their work settings. And I'd like you to watch as they share some of the experiences that they have had and how they have found to useful ways to cope with stress that they're experiencing on the job. I've asked 3 nursing assistants to join me today and talk a little bit about some of the sources of job stress that they feel in their facility. First, I'd like to ask each of you if you could share with us where you work.
I work at a hospital.
You work in a hospital. What kind of a
orthopedic unit?
Orthopedic, which is working with bone problems?
Yeah, definitely.
And muscle problems?
Yep, lots of physical therapy and stuff.
Okay. A lot of lifting in that job?
Yep, absolutely.
Okay, what kinds of patients do you get on an orthopedic unit?
We get lots of hip surgeries, we get knee surgeries, a lot of elderly patients, people that come in for reconstructive surgery, you know, anywhere from like 50 years old to 70 years old.
Okay.
So they usually like to get them in around that age.
Probably a lot of back surgery?
Oh yeah, we do have, yep, we have lammies, yep.
Okay. And how about you?
Nursing home, and I work on the Alzheimer's unit.
Okay, so you're working with the majority of the patients are disoriented and
Yes.
demented?
Yes, we have some that are fine and just have physical disabilities and can't be cared for at home, but
So the majority of cares that you're giving probably is complete care for them?
yes.
Okay. How about you?
I work in a nursing home in long-term care.
Okay, and what kinds of patients do you have?
You know, just older adults that can't take care of themselves anymore. They need help with their, you know, basic activities of daily living and that type of thing.
Okay, so some probably are able to do more than others in the nursing home that you work in.
Yeah, some are more independent and some are more, you know, total care. They need all the care that they can get.
Okay. What are the main causes of job stress in the places that you work? You can just jump in and speak, whoever would like to start.
I think it's trying to keep up with the demands of physical therapists, occupational therapists, all the things that you have to try to make their quality of life and try to get them to get going, to get better. You know, in the hospital you only have a certain amount of days that you're allowed to be there. And if you have a patient that is really needing that extra help, it can be time consuming, and you really need to help them and try to encourage them to get moving, and that can be frustrating for you and the patient, you know, as far as stress goes.
Are sometimes patients wanting to give up and just
Absolutely.
stay in bed? And what do you do in that situation?
Just try to encourage them as much as you can. You can't force these people, but you can just try to encourage them and let them know that they are in charge of their destiny and that they need to take charge of their health.
Okay. What are sources of stress in your work setting?
Shortage of staff and just always being asked to work overtime. It's real hard to say no sometimes, but it's something you need to do to be able to reduce your stress.
Okay. Is it quite common that you're short-staffed in your facility?
Quite a bit it has been.
Okay.
And there's just not enough people to get everything done that needs to be done.
Okay. How about you?
I'd say the physical nature of the work is very stressful. You know, many of the residents require a lot of assistance, and they're not able to bear weight, and gets really exhausting. Even if you use good body mechanics, there's still, you know, it's a lot of lifting. And
Because a lot of the patients that you care for aren't able to bear weight or stand and
right,
do a lot of that activities by themselves. Huh?
right.
How do you know? Does your body give you signals that you're under a particularly good deal of stress? And if so, what are some of the ways that you're aware of that?
You definitely get tired.
You get more tired when you're under a lot of stress?
Yep.
You want to spend a lot of time in bed?
Yeah,
And put your head under the covers
absolutely.
and just
Just want to
avoid?
go and sit down and say forget it.
Okay. That's true.
Just the frustration you feel from within, and you can kind of almost feel your adrenaline pumping, and
Okay, so you
Okay.
probably have your heart going a little bit faster,
Yeah.
and
kind of the
sometimes,
fight and flight.
yeah, those fight and flight feelings of stress that cause increased breathing. Your probably a little perspiration sometimes go along with that. You know, you had mentioned that earlier that you try hard not to show the stress, but it's all building up inside.
Yeah.
And you try to hurry the patients too much, because you know you want to meet the demands of all the other patients as well. You want to get your work done, and it can be frustrating. And yeah, everybody wants something all at the same time. It never fails.
Okay.
So you just do, and you have to, just go with it.
Okay. How do you feel? What symptoms does your body give you that you're under a lot of stress?
My muscles get kind of sore once in a while, and then, I just need to sit down and relax for a little bit.
So it's some aches and pains that you experience.
Yeah, mostly in the lower back.
Any of you ever take your stress home with you? Does that ever happen where some of the way you are at home might be different when you're under a great deal of stress?
Yep.
Can you give an example?
You have less, you don't have the patience, might not have patience with your children, with your significant other.
Yeah, with your husband.
Sometimes you have to catch yourself so that you don't lash out at them. You have to stop and think, hey, wait a minute. But sometimes it's really nice. They're real understanding, and you can vent towards them. And sometimes they vent their bad days they've had too.
Okay.
It can be very helpful.
Okay. I'd like to find out what helps when you're feeling a great deal of stress on the job. What are some of the things that you do for yourself that make the situation better? Anybody want to start?
I'd definitely say to walk away from the situation as long as the patient's safe. Always ask for help. Go to the charge nurse, these are things.
And how can
relieve the stress.
Yeah, how can the charge nurse help you if you're having a lot of stress? What kinds of things might
Well,
be
they
different?
can definitely help you out if you need something, if you need help turning a patient or, getting them up with, sometimes these patients take 3 to 4 people to get them out of bed. You need to ask for help just to relieve that stress of trying to get everything done. Sometimes you can't, so just go find some help to help you with that.
Okay. Anything else?
Just taking deep breaths. It relates to the physical stress, using good body mechanics, using your gait belt, bending with the knees so you're not, putting a lot of pressure on your back. And if you're taking care of the patients in bed, keeping the bed elevated so you're not bending over and putting a lot of stress on your back.
Okay. What are some things that you do outside of work? Are there things that happen that help in this situation when you're away from the job?
Well, I like to exercise, go to the gym. That helps, making sure you have time for your friends and stuff like that.
Go rent a movie.
Renting a movie?
Read a book.
Okay.
Ride a bike.
You like to ride a bike?
Do baking, bake cookies.
Okay.
There's many things.
To try to have some balance in your life and
Right.
and not focus
All on work.
entirely on work. Do you ever use where's your support system, or who do you turn to outside of work to help with stress relief? Is there anybody that can help with that piece?
I turn to my husband, of course. He doesn't always want to hear it, but he's pretty good. And if not, then coworker is usually the best way to,
Okay. Okay.
go on break and forget about it, go downstairs, get something to eat, and whatever.
Okay. I'd like in closing to ask you if you could you've all had lots of experience as nursing assistants in these different settings. And you've seen nursing assistants come and go, some quickly. Some you have stayed longer, and obviously there's a difference between why some stay and why some leave so quickly. And I'd like to ask if you have some advice for nursing assistants coming into this profession of how they can have a little bit better coping of stress that they might get on the job. What works?
You know, you don't want to be afraid to ask questions, ask for help. And I know in the class they only give you about 2, residents at a time to take care of, and then when you get out working, it's about 8 or 9. So you might want to ask for a longer orientation so you can get used to having a heavier workload. And
Time management is important. You need to learn how to manage your time. Definitely take your breaks. Take your lunch. You have to take care of yourself as well. Make sure your patient's safe, but take your breaks and, take your time for yourself.
Okay.
I think it's important that when you're taking care of these people, you realize the good feeling you get, and that you make sure you treat everyone as it could be your mother or your father. And if you are short of staff, don't beat yourself up because you can't do exactly everything that needed to be done. But just do your best you can.
Okay. One of you talked earlier about being asked to work overtime. I think that was you.
Yeah.
What advice could you give to people if they're asked to do extra time and
don't overextend yourself. Don't be afraid to say no. It's real hard for me to say no, but it doesn't take too many times to realize how much more stressful it is when you work overtime, and you get burnt out real quick.
All right, and in closing, I'd like to ask why it is that you chose this job, and why is it that you stick with it even though it is a stressful situation?
Just taking care of people, it really makes you feel satisfied and good about yourself, and to know that you can help people. And
It's fun to see all their different personalities. I think that makes or breaks the profession. It's a fun job, and it can be stressful, of course, but it can be a lot of fun. There's definitely more pros and cons.
It's that great feeling of satisfaction you get, knowing you might have made a difference.
Great. Thanks, gals.
You're welcome.
Appreciate your coming today.